Dr. Rory Gibbons. I'm a licensed naturopathic doctor in British Columbia. I'm a dad of three boys, 5 and under. We just had baby number two 2 months ago. So the people in the audience that have 3 kids and 4 kids and 2 kids that definitely understand the dynamic changes when you add a child. So it's like a 2 plus 3 equals 6 type of situation. Sorry, 1 plus 2 equals 5 situation. Anyways, it's awesome. I love it. I love being a dad, and I treat a lot of dads in my practice. So I have a focus in men's wellness. Things that I use in practice, I use blood work a lot when I'm working to create plans for my patients, run blood work, make calls based on that. And just want to double check. I see there's some chats coming in. Anyways, sorry about that. I use blood work in my practice because it gives me direction. And we're going to talk very briefly about magnesium blood work in a couple minutes here. But I love to use the foundations of health, diet, exercise, sleep, prescription, those types of things. But I also love functional nutrition, which makes me really align well with CanPrev and all of their products because it's all functional nutrition, like magnesium, vitamin C, D3, and those nutrients. I like them because they make sense to me and I get great results. In BC, my wife and I created Virtual Health Collective, where we are a virtual clinic and we see moms and dads and we support them through parenthood. It's the best job ever. I'm a speaker and an author, hence being here. And I always like to introduce or talk about a couple things that are unique to me. And I love coffee, as a lot of parents do, but I love good coffee though. And salty chips are definitely a vice. I like Star Wars and anything to do with riding bicycles. We live in Fort Langley and it's like bicycle mecca out here, road biking, gravel biking. It's just the best. Anything really spending time outside with the kids because honestly, everyone's happier outside. All right, we're going to jump into the content now. I'm just going to check the chat one last time here. I just see people saying hello from Stony Creek in Ottawa and California. Awesome. Thanks for being here. Everybody, I love how everyone's showing up to this. This is so wonderful. Very cool. Let's go. So magnesium is the topic, is the mineral of the night. So it's an incredibly abundant mineral in the universe, eighth most abundant mineral in the universe that we know of at least. It's the seventh most common element in the Earth's crust. It makes up about 2.7% of the Earth's crust. So that's a nice random fact to whip out at a party one time. Uh, but magnesium never really exists as magnesium. Okay, it always needs a friend. Okay, so it always exists as a compound with another molecule. And so this will make sense a little bit later when we talk about different forms of magnesium. It exists in Earth, it exists in the oceans, and exists inside us. Which brings me to, well, where does it exist inside us? Literally everywhere. 65% of magnesium is found in the bones, 30 to 40% is found in soft tissues, and 1% is found in the blood. It is found all over the body because it's used for so many biochemical reactions. In fact, it's needed for over 800 reactions, and it's used as a cofactor. So what the heck is a cofactor? Coming all the way back to Science 10, cofactor is something that helps a process. So, if there's an enzyme, it needs cofactors like magnesium in order to work properly. So it's a highly needed piece in order for an assembly line to function, basically. It's non-active. Enzymes are active. What the heck does magnesium do for us? It's everywhere, apparently. So probably should do something. So let's talk about what we know magnesium does. So the heart. I put this at the top because I like the heart. It's a very important organ, obviously, but it's very muscular in there, and magnesium has a really vital role with heart function. It helps regulate the rhythm of your heart. It modulates certain ions, specifically calcium and potassium in the electrical circuits within the heart, and also works to relax the heart muscle after it contracts. So that goes to the same function as skeletal muscle. It helps to relax. So after a contraction, the magnesium helps to relax the muscle. So same mechanism in the heart as it is in the musculature. Sugar metabolism, it helps to regulate insulin action. More specifically, it helps to open channels that allow sugar to move into our cells. And as someone moves into insulin resistance, or on the way to diabetes or into diabetes, this becomes more difficult because magnesium levels become even lower. So it's a vicious cycle here. This is where naturopathic doctors can just do so much good. Nerves. What does it do for nervous function? It helps to calm the nervous system and supports GABA's ability to work. So there's two things that come up here that I use this for, okay? With someone who has an elevated level of nervousness, maybe not diagnosed anxiety, but just they're on edge, okay? Magnesium comes in, brings the nervous system down, just doesn't sedate you, just takes the edge off. GABA is really important at nighttime. Okay, so magnesium helps GABA do its job, helps produce GABA, and helps GABA do its job in putting us into deep sleep. Kind of an important role there. So I use GABA and magnesium together for sleep a lot, and it works really well for people who are just like stressed out and can't sleep. Cellular energy. Every cell in our body creates energy for itself in order to work. Okay. Every energy cycle, I'm going to throw some big words out: glycolysis, Krebs cycle, phosphorylation. In every cell, magnesium it's all magnesium dependent. So they all need magnesium in order to make energy. Okay, so if magnesium is not present, this will not occur as efficiently. Kind of an important piece in the energy cascade. DNA and RNA and protein synthesis, also incredibly important because we are constantly making and remaking proteins in our body. Okay, it's needed here in order to activate enzymes that create the DNA and the RNA and the proteins. Right? So you can imagine all of these steps all need magnesium. It's kind of important. Okay, lots of steps to creating protein. That's all. Oh, man, I only have a certain amount of time. I would love to talk at length about that. Enzymes, as I said before, it activates enzymes for protein synthesis. So we can see a lot of uses here. So what happens? What happens if there's low magnesium? So here's some conditions that are related to low magnesium. May not be the low magnesium may not be the cause of these, but they are related. Okay, so GERD, gastroesophageal reflux disease, and heartburn. So those things are associated with low magnesium. Okay, so it can be a cause of this, but also the medications that are used to treat these things, these conditions, can also deplete magnesium. And we'll find out that it's actually due to low acid. So acid blockers block the acid from being produced, which helps to dissociate the magnesium from its compound in order to be absorbed. Right? So when we have low acid conditions, I'll talk to you about in a moment, then we have low magnesium. Mood, anxiety, depression, stress, panic attacks, all associated with low magnesium. And that's why I use magnesium in order to help these patients get through these like feelings of nervousness, feelings of sadness, and stress and panic. Okay. Alzheimer's disease, dementia, ADHD, all of these are associated with magnesium deficiency. But when you are working with someone with these conditions, we need to see the person globally and treat them globally, not just be like, magnesium's your thing, here you go. Like, we got to look at diet, we got to look at, the other confounding factors, other lifestyle factors. Conditions in the heart, high blood pressure, arrhythmias, angina. So high blood pressure, I use magnesium to bring down high blood pressure. CanPrep has a really great cardio magnesium where it has a couple other things in it that help with the heart in general. Arrhythmias. Arrhythmia is like an irregular heartbeat. Okay, so magnesium is really great in regulating heartbeat. Heart palpitations is also something that comes to mind, very associated with anxiety. So someone comes and like, oh yeah, I feel like my heart's beating in my chest. That's like, okay, that's a heart palpitation that they're feeling. And magnesium may help to bring down the nervousness, which may be causing that, but also maybe helping to relieve the the what's the word? The arrhythmia, the arrhythmic beat of the heart. And then angina is heart pain. And so that can be associated with like a constriction of the vessels in the heart, and magnesium can relax that. Vitamin D deficiency. Chances are, if you have low vitamin D, you probably have low magnesium as well. So magnesium is used to convert vitamin D forms, and so this is a really great point, because magnesium and vitamin D are things that that most people need, especially in Canada. Living at the latitude that we do. I've been testing testing vitamin D a lot lately, and man, so many people are coming back as deficient. So if you haven't had that tested recently, go and ask your doctor about it. Ask your GP to run vitamin D. I mean, I know in BC it's private, or so it's not private. You have to pay out of pocket for it, but it's about $80, I think. It's really helpful because it kind of guides your vitamin D dosing. Low energy. So magnesium does have a role in energy production, right? So conditions like chronic fatigue, muscle fatigue, fibromyalgia, chronic stress, these types of syndromes can be associated with low magnesium. What I find in these situations is that magnesium is like a piece of the puzzle. Okay, so someone with chronic fatigue, for instance, nutrient status is one piece, stress is another piece, physical activity and muscle mass is another piece, diet is another piece, and social interaction is another piece. So it's like all, and that's just scraping the surface. And so, understanding that where magnesium fits in is really important, where other nutrients fit in is really important too. Again, that's where naturopathic medicine really shines. In pain, it has a role in pain. So muscle pain, PMS, the premenstrual syndrome, menstrual cramps, such as PMS, dysmenorrhea, headaches, and migraines, all can benefit from magnesium. This is a really interesting one because we know exactly where the magnesium works, and it works in the central nervous system, and it blocks these little channels called NMDA receptor channels, and it goes and binds there, and then it can block the pain signals from the central nervous system of the brain. It's really incredible. So I use this for anyone that's associated, or anyone's that dealing with chronic pain. It can be a real piece of the puzzle that can put that person ahead and break a cycle. On that note, it's really helpful in recovery after physical work. So for my people that probably bodybuilders, for instance, or strength or power lifters, for instance, they can get pretty sore. So giving magnesium can help take that edge off and take the pain down and help recover those muscles. Very cool. So another question is like, okay, we're thinking like, okay, low magnesium is connected to all these things. Like, are we getting enough in general? Answer is probably not. So why? Why are we getting less? A big reason that I've noticed, but also is present in the literature, is industrialized agriculture. So farmland is being overused. The soil compaction and surface irrigation, pesticides, chemical fertilizers all impact the soil's ability to restore and retain and provide magnesium. As crops grow in size, they all take from the same pool of magnesium, right? It's just getting lower and lower and lower every time. And we're just like, the plants are just taking the magnesium, and then we eat it, and then it's gone. Food processing, with every step of processing, nutrients can be changed or lost in the food. For example, this one's crazy: heating, milling, grinding, mixing. So here's a perfect example of this situation. Whole grains can lose around 80% of their magnesium through milling, period. Like just one step milling can lose their magnesium around 80%. Water treatment. So when we treat the water to make it softer, it can be more easier on the pipes. We are actually taking minerals out, magnesium being one. Lower stomach acid. So here's what I'm just coming back to lower stomach acid. We need acid in the stomach to dissolve magnesium into a usable form. So that's magnesium citrate, magnesium malate, all the magnesium salts. Okay, salts, magnesium salts. Magnesium glycinate is not a magnesium salt. With age, Stomach acid decreases. And with the amount of chronic stress we all experience, we are also decreasing acid too at a younger age. Then we get heartburn from the low acid, and then palliate with antacids, which work in the short term, and then they deplete the magnesium. It's a bit of a vicious cycle there too. So here's some magnesium depleters in your life. Absorption blockers is a big one I see is like drug-induced magnesium depletion. So antacids and acid blockers, as mentioned above, because they're reducing the acid levels in the stomach. Some antibiotics and some heart medications like some heart medications. So like blood pressure medications, thiazides, loop diuretics, hydralazine, digoxin. And I bet some of the people in the audience today definitely are on blood pressure medication because they're becoming more and more common. Chronic stress is a magnesium depleter. We burn through it. Like for all those stress pathways and the energy pathways, we need magnesium. So we're like stressed out trying to do all this stuff and we're just burning through them. That and B vitamins. Smoking doesn't help anything. It is depleting magnesium, and alcohol abuse that can definitely flush out the magnesium. Excuse me. Very cool. Dun, dun, dun. Just checking that, making sure I don't have any messages telling me to stop talking or something, or can't hear you and start all over again. But we're good. Am I deficient? So here we are talking about magnesium testing. And so we can test magnesium a couple different ways. Blood is the most common way. So remember that 1% of magnesium is found in the blood. So it's a very tightly regulated system. And so your magnesium levels in the blood or urine may not reflect the levels in your body as a whole. Okay, so this test is not useless by any means, so as it can indicate larger problems if your magnesium is high or low. So that's the magnesium test itself. So blood magnesium. And then you can, if you want to be a little bit more specific, you can pay more and get a magnesium red blood cell test. It gives us a better indicator. So getting familiar with symptoms can be very helpful here. So here are just a few symptoms that I see on regular clinically. Okay, so obviously signs and symptoms are not limited to this list. This is something that I see often. Headaches and migraines. Depending on the origin of the headaches, magnesium can be the nail in the coffin to getting rid of it. Fatigue, trouble sleeping, anxiety or feelings of nervousness, muscle soreness. Yeah, all of this stuff. Magnesium is going to help put the fire out in these areas. High blood pressure, yep, along with other things, and palpitations, like I mentioned earlier. So contributing factors to having a deficiency of magnesium in your body, chronic stress, and the medications that I was saying, antacids, or the GI disorders where you're not absorbing. So if you have some of those symptoms and some of these other lifestyle stuff that's going on, there's a good chance you may be deficient. Sorry, there's a good chance you are deficient or at least depleted in magnesium, and you could probably benefit from it. In your diet, I mean, magnesium is everywhere, right? So we can have it through diet. However, sometimes when we're treating specific issues like headaches, for instance, saying, okay, eat some more nuts and whole grains and legumes, and then your headaches will go away. There's the same amount, there isn't the amount of concentration of magnesium in foods than there is in the capsule. Okay. So when we're treating those types of issues, we use therapeutic dosages. Okay. So higher levels of what you're going to find in your food. What I love to do is use nutrients like magnesium to get people out of cycles and then introduce more food and food sources of the nutrients in order to carry them forward. So where can you find them? Nuts and whole grains, legumes, leafy greens, fish, meat, dairy products. These ones here. So what I see in this list is a Mediterranean style diet. And I love Mediterranean style diet. Such a sucker for a really good olive oil. Man. Okay. So on that note, everyone's thinking, okay, so I should probably take magnesium. So which one do we get? Well, it depends, of course. Like everything in the wellness industry, it really depends on what you have going on. So all these magnesium salts have different uses in the body. Okay. Um, we need to think of like how well do we need it to be absorbed? Okay. This is a absorption rate bar graph. Okay. Now, from left to right, we see that magnesium glycinate more highly absorbed than the other ones. Okay, I'll tell you why in a moment. So think about where magnesium is needed for the issue that you are concerned about. Okay, so if it's needed in the central nervous system or intracellularly, we need it to be absorbed well in the gut. Okay, and have the second part of the salt be helpful. So the second part of the salt being the malate 3 and 8 aspartate citrate oxide. Bisglycinate is an amino acid. Okay, put that away for a second. So magnesium malate, for instance, so small and well absorbed, and the malate is used in the mitochondria to support energy production. Okay, magnesium bisglycinate, the first one. Sorry, I jumped around a little bit there. Magnesium glycinate, really useful in the central nervous system. So the magnesium, so the glycine is really small. Okay, so it's a small molecule, so it's easily absorbed through these dipeptide channels instead of the magnesium being moved through other channels. Sorry, I'll clarify that in a moment. So magnesium citrate, for instance, a larger molecule, absorbed less efficiently. So at higher doses, magnesium uses laxative. I use this often to get people's bowels moving. That being said, when you use any type of magnesium at higher doses, it goes as laxative. We have this like internal magnesium governor that stops absorption when we get enough. It's really incredible. Magnesium oxide, right down here, right down here. Like, oh man, that's a crummy absorption rate. Well, when it mixed with water, it's magnesium hydroxide, and it also looks white, and it's also known as milk of magnesia. So a common laxative, right? I use magnesium bisglycinate, not exclusively, but almost, just because it's excellent bioavailability to the body. Using it mainly for stress support, mood, and muscle recovery in my practice, and sleep. Very interesting stuff here. So let's talk about magnesium 3 and 8. It reaches the brain cells more effectively than other forms of magnesium. In the brain, magnesium regulates ionic activity in nerve fibers by making sure calcium is moving along properly. Too much calcium in a neuron can make it overactive and then potentially die earlier, leading to neurodegeneration. So, in other words, Alzheimer's and dementia. So magnesium is there to keep things moving along the nerves. So because of its action in the brain, I primarily use this one for acutely for people that have recently had a concussion or suffered from some concussions in the past and are having some brain fog, memory issues. So the magnesium 3 or 8 goes straight to the brain, really helpful in providing neurological support. Magnesium citrate plus. So what the heck's the plus? Well, it is malate. The plus is malate. So magnesium citrate plus is a combination of the citrate plus malate. And so the malate is introduced here to increase the bioavailability of the magnesium because it's smaller, right? If we go back to that chart, the magnesium malate is a certain level of availability, and then the magnesium citrate is lesser. This one's great for people who are looking to increase the magnesium stores overall and get a little bit more energy and move their bowels a bit more efficiently. Magnesium malate. So this is increasing energy and metabolism. Great for someone who's looking to improve the magnesium stores overall again and energy. It happens all at the level of our magnificent microscopic powerhouses called the mitochondria. Yeah, I love the mitochondria. Yeah, almost every single one of my treatment plans involve some sort of mitochondrial support. Good question here is, where are the mitochondria? And short answer is everywhere. But high concentrations in the heart muscle and the skeletal muscle and the sperm cells. Very high concentrations of those areas. Much needed for energy pathways like the glycolysis, like Krebs cycle, and phosphorylation. Those are the main energy pathways in our body for producing the energy molecule called ATP. And then we have our lovely full spectrum magnesium. Here we go. It's a combo product. This is a great overall magnesium. If someone that doesn't have really any specific concerns, but or they have a like a bunch of different ones, this may be a good option for them. Also, when you're picking, I'm throwing a lot at you guys tonight, but when you have someone on your team, like a naturopathic doctor or like a functional nutritionist or a functional doctor or something, they can really figure out which magnesium, which supplements to direct you to. So let's talk about aspartate. We haven't talked about aspartate yet. And so it's something I don't really use a whole lot in my practice, but it helps to build amino acids that support overall metabolism, immune system, cardiovascular system, and the nervous system. So there is some really great effects of magnesium aspartate. So it's a good addition to this product for sure. But, I'm going to come back to the king. This is the cream of the magnesium crop, the magnesium bisglycinate or magnesium glycinate or magnesium diglycinate. They're all the same. The excuse me, the language and the names by bisglycinate, glycinate, and diglycinate all mean all the same things. So remember the chart again, the absorption chart. Magnesium glycinate, very high. Small, really well absorbed. So it is not a magnesium salt. So magnesium malate, threonate, citrate, when they are bound, they are not as bound as tightly as they are bound when magnesium is bound to glycine. Okay, so magnesium glycate, very tightly bound. The other ones bound, but can be dissociated in an acidic environment. Okay, so let me just give you an example. You take some magnesium citrate, it comes down into the stomach, and you have adequate acid. So the acid breaks that apart. Okay, and then the magnesium can be absorbed into the body through specific channels in those acidic environments. Right, the whole gut is not acidic. Okay, it changes, the pH changes when you get into the small intestine. Magnesium glycinate is bound very tightly. Okay, so it comes down into your gut, which is very acidic, and then, or into the stomach, which is acidic. It does not break apart. Okay, it goes through channels in the small intestine called dipeptide channels, and it goes straight through. Okay, and they're located all along the intestinal tract, so in a higher abundance. So this is why the bioavailability is higher, because they're accessing different channels, different gates to get into the bloodstream. If you think about like a stadium, for instance, you have your ticket and it says go to gate 50, right? And so you can only go to gate 50, but if you have a ticket that says use any gate, you're going to get in pretty quick. And all of your other magnesium glycinate tickets are going to get in the same efficiency. That's why I use this one the most. Strong bonds protect magnesium from other reactions as well that may make them unabsorbable. Canprev's got a lot of different options for magnesium. We've got gentle, extra gentle, ultra gentle magnesium glycinate. These ones are very good to know about if you're treating someone with a sensitive stomach. Okay. I see some people raising hands, which I love. Please just ask a question in the Q&A box and I'll try to get to it. Thank you so much. So when you are dealing with someone with a sensitive stomach or an inflamed stomach, like inflammatory bowel syndrome, like Crohn's or colitis, or irritable bowel, too much magnesium can flare that up. Okay. So, for instance, someone without any issues, no gut issues at all, they may experience diarrhea at like 600 milligrams per day. Okay. Someone that does not have those, or someone that has, let's say, irritable bowel syndrome, they may experience diarrhea at 80 milligrams. Okay. So you're going to get a magnesium that delivers less magnesium per capsule because you can't break apart a 200 milligram capsule. Okay. You can get ultra gentle, which is 80, or extra gentle, which is 80, and ultra gentle, which is 40 milligrams. Okay. So again, having someone on your team that can direct you to a magnesium that won't flare up your issue, kind of important. I love CanPrev's goal specific magnesium bisglycinate. When I was saying earlier, there's a heart one. There's also one for sleep. There's one for energy. I encourage you to check out that on the website. And that one lucky person walking away with all the magnesiums, they'll get a couple of those too. It just really makes the consumer experience easier. So when you go in, you're like, I need magnesium and I also have high blood pressure. Magnesium cardio is probably a good idea for you. I love how CanPrev has powders, capsules, and liquids. Okay. Some people just get pill fatigue. It's just like, I don't want to take any pills anymore. I'm taking too many. So if you have a powder, then you're drinking it. It's just, and the taste of these powders are fantastic. I love it. The liquids are also very tasty. And I don't really have much else to say about that. I mean, it delivers the same type of magnesium. It tastes good, and they're great to have an option. Oh yeah, and electrolytes. I love the electrolytes. So CanPrev has the Electro Mag, and they're like they're little electrolyte packets. And you can open them up, put them in your water bottle or in a cup, and you can have that as an electrolyte. So there's like vitamin C in it, magnesium, and something else, I think. And it tastes delicious. CanPrev's other brand, Orange Naturals, also has Mag Pops, and they are the um, similar ingredients, but just orange flavored. They're fantastic too. So if you have kids, that's not a bad idea. And also if you're someone who exercises, that's also a really great option for post-exercise. Getting some magnesium in there, getting some vitamin C. It tastes good. So we talked about a lot of things tonight. Okay, this is a little bit shorter presentation to allow more time for questions. But let's just summarize. So what is magnesium? We talked about that. Where does it live? Okay, it lives in our bodies, lives everywhere around us, but most importantly, it lives in our body. 1% in the blood, 65% in the bones, and 40%-ish in the soft tissue. Excuse me. We talked about lifestyle and dietary factors to how to eat magnesium through diet, but also things that are going to deplete the magnesium. Remember that? Like it was like smoking and certain medications and and alcohol abuse. We talk about if you should take magnesium, and basically like everyone can benefit from taking magnesium depending on what type though, right? Like we got to think about which one is going to be the best for our bodies. And we also learn about how magnesium is absorbed, which I didn't write down, but that one we talked about how it was absorbed. I love doing these webinars and chatting with you guys. And so if you want to learn more about me and my practice, feel free to check me out on Instagram or even Facebook, or you can go to my website, check out the content there, and send me an email through my website if you want to get in touch with me specifically. Would love to chat. I'll do my best to get back to you as soon as possible. And also, of course, follow CanPrev. If you're not already on social channels, they have some really great stuff on there. Really helpful tools to improving your health. And I just love these products too. Let's answer some questions. Thank you so much for listening. So I bet Delreen has been crushing out the questions in the back end here. I'm going to open up the Q&A. Oh man, okay. This person asks, hi there, is this recorded and available afterwards? Yes, somewhere. You could probably, I don't know when, I don't know how fast it is uploaded, but it's usually on YouTube. Chin says, my ongoing queries. Does magnesium spray give same benefits as powder or magnesium? Does magnesium leach calcium intake? Magnesium spray, you know what? Magnesium spray, some people swear by this magnesium spray you put on your feet and it makes them sleep. I don't really understand how that works specifically. I know there's a great absorption through the feet. Maybe that's why. Um, but to stack them up next to each other, again, we got to go back to what type of magnesiums you're using and what you need them for. So it's hard to, sometimes it may be comparing apples to oranges. Does magnesium leach calcium intake? Nope. Chin says, is it most beneficial to take magnesium before bed? I usually recommend before bed just because it has usually for any concerns, because it'll help you sleep. And that sounds good to me. And when we sleep, we restore. Best time to take magnesium and GABA before you go to bed. Maybe like 45 minutes before you go to bed. In your opinion, are the top best natural foods highest in magnesium? Nuts and seeds, meats, leafy greens. Those are probably the most those are the most readily available. Can magnesium be helpful during labor? I don't know how much difference is if it's going to really make, unless it's administered intravenously. I don't want to mess around with giving anything during labor. Like, there's other things you can do. So please talk to your midwife or your OB for that, or your naturopathic doctor about things that can be helpful during labor. I'm guessing to calm down, um, but that's not really my area of expertise. Stephanie asks, how much magnesium should take if you lift heavy 4 times per week? Sometimes my recovery takes days. Yeah, good for you for lifting 4 times a week. I love it. I love it. In this situation, of course, any of these questions, these are not medical advice. Having 200 to 400 milligrams after a heavy lift is going to be helpful for anybody. Good job. The other things you can be taking to improve your recovery, though, like branched chain amino acids, something that's high in leucine, and isoleucine. Those are the main ones. Can you take magnesium with L-theanine instead of with GABA? Yeah, absolutely. Yeah, L-theanine's rad. It acts so fast, 30 to 45 minutes. It's in the brain. After taking it, I use this a lot. That's Elisa. Thank you. I just like to use magnesium and GABA together because I know GABA works in the deep sleep. L-theanine, magnesium and L-theanine throughout the day might be helpful to reduce feelings of nervousness. Question by Elaine. How much milligrams of magnesium most effective for females 30 to 50? How much vitamin D? Doing research, finding lots of folks have increased vitamin D intake 3,000 to 10,000 with great results. Yeah, Elaine, it depends on what's going on. Okay, like we can all do our research online and we get some really questionable things. What I've found that when people increase vitamin D to 10,000 IUs, they don't know for how long. They go, I'm taking it for years. Vitamin D can leach calcium, not magnesium. So from what I can see from the research that I have, 5,000 IUs for about 3 months is the safest upper limit that we know of. So I can't really answer your question. You need to ask your doctor about that, or your naturopathic doctor. Everyone's different. Get your vitamin D tested. Oh, that a really great this brings up a really great like segue. Like there is something called a level of diminishing results. Okay. A point of diminishing results where you get into a range that's optimal, defined by thousands of trials and results. And if you have more, it's not always better. Okay. Like your results may not change. Christy says, can magnesium help with menopausal symptoms such as hot flashes, sleep disturbance? What is the difference between magnesium types and which is one is easier on the stomach? We talked about that, well, the differences, and magnesium helping with menopausal symptoms such as hot flashes. Yeah, that can help. I don't know about hot flashes itself. It could improve if you're being really sticky, you could improve the clearance of estrogen and hormones to the liver, but I wouldn't use magnesium as something to help hot flashes themselves. Sleep, definitely, but not specific hot flashes. Cynthia, Cynthia, that's a really amazing name. Is vaping a depleter as well? I don't know specifically, but vaping uh, freaks me out because, we don't really know. It's not really very regulated. So you don't know what you're putting in your lungs, and when you vape and you burn the oil, you combust, it goes in your lungs and stays there. So it's not helpful. I don't like vaping, as you can imagine. Can you take too much magnesium in supplemental form? Yeah, like I mentioned in the presentation, there we have an internal governor. So if we have too much, it goes out in the form of diarrhea. It's around 600 to 800 milligrams, I believe, I think is the level. You can take too much magnesium intravenously, though. Which type of magnesium? Calcium is best for Crohn's colitis. So we're looking at like an absorption issue here, right? So you want to get like a really well absorbed one. And we all learned tonight that magnesium glycinate is probably the best one for that. This person asks, I've been experiencing tight calf and quads, which cause pain and sometimes radiate to the knee. I'm pretty sure reactive. I'm told I'm deficient in magnesium. I've been having acid reflux. So I've been looking at magnesium gel to use daily as well as taking magnesium supplement. But there are so many forms. I'm not sure which one is right for me. Do you feel magnesium gel would benefit me in chronic muscle tightness? Yes. And magnesium glycinate would be great for the situation. I think magnesium gel might be helpful too. I don't really prescribe magnesium gel a whole lot, just like internally. And hydration. Make sure you're hydrated. What is the daily recommended magnesium dose for female, adult, and children? Uh, recommended magnesium dose. I don't know, actually. I think for kids, upper limit's like 50 milligrams, but I'm not really sure on that one. I don't even know if there's a recommended magnesium, unless you're talking about RDAs, which I don't really pay attention to a whole lot because most people are meeting them. Can you explain what chelated means and does to the vitamin? So chelated means by itself, basically. What amount should be taken after surgery? Same or more? Uh, yeah, I would say, yeah, just magnesium glycinate would be the best for anything after surgery. Ali C says, should magnesium be taken at different times from calcium? Do they have the same receptors in our bodies? They have different receptors. I mean, magnesium can bind to receptors, also binds to enzymes. Calcium, I mean, we make CalMag products, right? So they can be taken at the same time for sure. Magnesium and iron, different story. They can bind theoretically. Does your pH show what your stomach acid level is, or is there another way to test your stomach acid levels? Man, this is a great question. You can't do like there's no specific way of testing stomach acid levels at home. There is this thing called the HCl challenge, the hydrochloric acid channel. My goodness, hydrochloric acid challenge, where you eat a bunch of acid or acid pills, basically, like HCl pills, not the other acid, of course. But the way to really test your pH in your stomach, evidence-based wise, is like this little thing you swallow and it looks at the pH that way. You have to get that through a specialist though. Nav says, is it possible to take too much magnesium? So what are the consequences? Diarrhea. That's what you'll get. Is it safe to take magnesium while breastfeeding? Yep. If so, which ones are best for symptoms of high blood pressure, headaches, and anxiety? Yeah, I mean, I kind of answered this already for blood pressure, like the things that are more well absorbed. Malate is good for muscles and energy systems, and then glycinate is good for high blood pressure. But also, if you're getting high blood pressure, don't just take magnesium. Like, get this assessed and looked at more specifically. Okay, and if you have high blood pressure and headaches and anxiety, these are all connected for sure. That's you raised your hand, so hopefully that answers your question. Chin says, what are the negative effects of taking too much magnesium? Fully deplete calcium? No, it won't deplete calcium. And the only negative, there are no negative effects unless you take too much and you get diarrhea. Elaine, you spoke on magnesium deficiency contributing factors, one of which is health conditions. Can you mention a few we should be familiar with? Urticaria, my sister been dealing with it. Urticaria, I wouldn't go to magnesium deficiency for urticaria. This can be a lot of different causes for urticaria. Um, looking at food allergies, environmental allergies, mold exposure, immunodeficiency, sorry, immune modulating medications, those types of things can affect urticaria. That's a big question for sure. How long does it take to feel the effects of taking magnesium every day? I find people notice it very quickly, like within days. Christy says, do you recommend magnesium oil spray? No, I never recommend it. What are the benefits of topical spray versus oral? Topical is probably obviously absorbed through the skin. I don't use it a whole lot. I just hear people, you like to use the one that goes on your foot, on your feet, on the bottom of your feet. I use the oral magnesium no, exclusively, unless I'm doing an injection or something. Question for Healthy Planet team. Last month was not on the your channel. Yeah. Maybe Delreen can reach out to the Healthy Planet team on that one. Donna, okay, running out of time here, but I'll try to get through them all. Donna says, best magnesium for Dupuytren's contracture. I don't know. I think you're going to need something different for Dupuytren's. You can always just default to magnesium bisglycinate. I don't know if that's going to help you though. Unfortunately, I don't know if there's any evidence that says that it helps Dupuytren's. I have IBS, never been able to take magnesium. I'll try this one. Okay, Roxanne, that sounds good. Barbara says, what is the best amount of magnesium to take if needed for sleep? Depends on who you are, right? Like I usually start people off with like 100 milligrams or 150 milligrams and then work up from there. And if that's not working, then I add something else. But make sure you're getting your like sleep hygiene in order. Like just get off your phone and make sure the room is dark, make sure the room is cold, quiet. If not, wear an eye mask, wear earplugs, use a sound machine, dim the lights, those types of things. Are electrolytes okay for diabetics? Yeah, I think so. Which types of magnesium do you typically recommend for help with migraines? Glycinate is usually my go-to for most of these types of things. But also magnesium threonate is really great for the brain. So depending on the origin of the migraine, we need to treat that. We need to treat the cause. Sanj K says, when is the correct time to take magnesium bisglycinate? I recommend it at nighttime. You can take it during the day. There isn't enough. There isn't an answer to the second part of how many times you can take it during the day. RD says, thank you so much for all the info. Is there a best time to take my magnesium? I always recommend it at nighttime. What foods are great if I don't do dairy or soy? Watching my cholesterol and my glucose levels. Yeah, you know what? Easy thing you can do. Just Google magnesium food sources and you'll get a lot of information there. And that'll help you for sure. Can you please list where magnesium is found in the body? Yeah, that was in the presentation. In the bones, muscles, blood, everywhere. Sandra says, how efficient is magnesium for chronic muscle pain? How efficient? It works well, but it has to be combined with other things. How to administer? Usually orally. Restless legs, glycinate would be great. What can we take magnesium with for better absorption? Um, it's a good question. I don't know. I'm not sure. How do you know you're not absorbing it? That's a better question. Can you please show the magnesium deficiency slide again? Magnesium deficiency slide. There you go. Yeah, there you go. How does magnesium bisglycinate work for those who have osteoporosis? Well, it's found in your bones, so it's going to help with vitamin D conversion, and it helps to keep calcium where calcium needs to be, which is in your bones. So that's pretty helpful. CalMag is a really great one uh, for osteoporosis, along with vitamin D and K2. What about magnesium balm skin absorption? Is it effective? I don't know. Never heard of it before. Sounds cool though. Shannon Palatsky says, will all the questions people put in the chat be answered, or we'll just go, I'm trying to get through them all. Bisglycinate, how to know how much dosage, take it on the bottle. That would be great start, unless you talk to someone with experience like myself. But I don't know you, unfortunately. How does magnesium block thyroid medication? Not that I know of. I don't know why I would block my thyroid medication. Can I take magnesium while on blood pressure medications? That one you're gonna have to talk to your doctor about. Okay, I don't want to answer that question. Theoretically, it should be fine, but I can't give you any. I don't want to give you any answer to that one. Talk to your doctor about that one, please. Taking magnesium and shake should be vegan or whey, and should you avoid? No, just take it. It shouldn't matter. Can magnesium threonate be taken to deal with general brain fog? Yeah, try it. That sounds great. It helps with brain, right? But also there's a million reasons why someone would have brain fog. Okay, I'm running up to the end of the presentation here. What is the best way to take magnesium along with vitamin D? Take it in a capsule and then take a drop of vitamin D, I guess. But you can also get CalMag D, and that includes vitamin D. And a lot of products have CalMag and D in there. But when you're taking vitamin D, I usually like to have more than what is in a serving of the CalMag D. You take magnesium at the same time as fish oils, vitamin D, protein, any supplements not to take it at the same time as magnesium. I recommend them take them, take them anytime. I'd rather have someone take them than forget to. How long does it take to see effect of taking magnesium? It's pretty quick, like days. Would magnesium help with body temperature? I don't know. Depends on what your body temperature issues are. Kalisha says, I've been experiencing tight calf. Oh, we answered that one. Is there a specific other nutrient or food for that magnesium should be paired with? No, I don't know. What magnesium is best for? Talked about that. If you have been diagnosed with glioblastoma, can magnesium help the nerves and brain? You need to talk to a naturopathic doctor who specializes in cancer. I don't really know about that. Good luck. I wish you all the best with that. If you need resources, feel free to reach out. Can GABA and ashwagandha be taken together? Yes. Stephanie, lots of questions from Stephanie tonight. Can you take magnesium if you're on blood thinners? Yep, I think so. How do I take so many supplements in a day when we only have 24 hours? What can be taken together as far as vitamin? Okay, that question is it really highlights a problem in the wellness industry. Okay, you don't need to take all the supplements. You need to take specific supplements for you. Okay, talk to someone about that. If you're taking more than like 3 supplements, someone is doing a disservice to you, and it's probably the wellness industry. So I'm sorry about that. What are your thoughts on magnesium without the oxide portion? They're good. The oxide portion is usually a laxative. What type of magnesium is best for someone with high blood pressure? Talked about that already. 50-year-old, 2 stents, taking it recently and taking protein and feel constipated, can I take citrate? Yeah, sure. Try citrate. But also, why are you getting constipated? Maybe you should take care of that first. figure out why you're getting constipated. Could be the increased protein, depending on how much you're increasing. Oh, sorry, you said you've been taking magnesium 200 milligrams at night to help sleep. That's great. If that, you yeah, I mean, you could try changing the dosage of magnesium glycinate, or just adding 150 milligrams of magnesium citrate to get at nighttime. That's probably when I would recommend to do that. Does magnesium have any effects on uterine fibroids? I don't know. I'm sorry. Does magnesium cause kidney stones? I don't think so. Any vitamin supplements that interact with magnesium should be avoided taken together. I think I'm pretty sure I answered that one. Okay. Does daily caffeine coffee drinking affect magnesium and iron absorption? Theoretically, maybe. But I haven't seen clinically this issue. Only magnesium plus iron that I've seen an issue. Sunday, yeah, I just answered this. This is the same question as someone else just asked. Is that, yeah, that's the same question. So yeah, all of these questions tonight you need to talk to your doctor about this one, okay? Or all of them. Like, I can't give you medical advice. These are just questions that I'm answering. They're not, you need to see someone specifically for your own health, okay? Get someone on your team. Most people have benefits if you do not. Try to find someone that has like a sliding scale, or go to the CCNM school. CCNM school in Ontario or in Toronto. Get some like discounted care. You see a student, but you're being helped by a doctor. Really great option for people that are that can't afford to see a naturopathic doctor, because I do understand it is expensive for some people if benefits don't cover it. Thank you so much for all of these amazing questions. If there's other questions that you have, please reach out to the CanPrev team. They're very receptive and very respectful of questions. Thank you very much. I'm going to stop the I'm going to stop the webinar now. I appreciate your time, and I appreciate you guys showing up tonight. I really appreciate it. I'm honored to be able to share my knowledge with you as a naturopathic doctor. So thank you, thank you, thank you. Have a wonderful night. I'm going to go upstairs to my screaming children. All right. Thank you very much. We'll see you at the next webinar. I'm doing one in the fall, I believe, on cardiovascular health.